I'm from Seva at Home. Today we have Dr. Vinayak Agrawal, who is Director and Head of Non-Invasive Cardiology at FMRI, Fortis Memorial Research Institute. So Dr. Vinayak, as per ICMR, Indian Council of Medical Research, 28% of deaths accounts for heart attack. So do you want to add something? Why Indian population is more prone for this heart diseases?
That's a very important issue, and a very alarming one as well. If you look at the current statistics, 1 in 10 individuals below the age of 40 years and 1 in 4 individuals below the age of 50 years are getting a heart attack in India today. We are a young nation, almost 537 million Indians are below the age of 55 years, so we are a young nation, which means that numerically we will have many more young heart attacks and strokes at a younger age. But it's also because we have a higher risk factor accumulation. So the 9 risk factors that cause heart attacks and strokes are your age, more than 50, which I think in India should be 40 cutoff. Males are more prone than females because they're protected by premenopausal age. Then family history of heart disease is important in our country. There is history of blood pressure, sugar, high cholesterol, smoking or tobacco chewing, low fruits and vegetables in our diet, sedentary habits. These are the 9 risk factors which are documented in the Inter-Heart study, which was done in 52 countries on over 15,000 people. And Indians tend to have higher risk profile based on these risk factors.
Okay, that's why Indians are more prone for the heart attack. So nowadays we are listening a lot of celebrities, they are dying because of sudden cardiac heart disease. This Siddharth Shukla, KK, who's our singer, right? Satish Kaushik and Om Puri. There are so many celebrities, and even across us we are listening like very young heart. Very young people, they are dying because of the heart disease.
So sudden cardiac death is a very broad term, and it has many causes, including heart attacks, or what we call in our medical language myocardial infarctions. Most of these sudden cardiac deaths occur if they occur with an onset of chest pain, which is in the center of the chest. Usually the chest pain of heart attack starts in the center. It is diffuse pain relating to both arms, jaw, back, very intense, associated with sweating, breathlessness, palpitations, etc. So that's a classical heart attack. A lot of these patients develop arrhythmias like ventricular tachycardia or ventricular fibrillation and have a sudden cardiac death within the first 1 hour of the onset of chest pain. It is 50% of the people will not be able to even reach the hospital for proper treatment. So that is one reason for sudden cardiac death. The other sudden cardiac death risk can be arrhythmias which are not related to plaque rupture or heart attacks, and these can be certain arrhythmias which are related to diseases like long QT syndrome, Brugada syndrome, etc. There are some heart muscle diseases like hypertrophic cardiomyopathy which may have more instances of sudden cardiac death because of arrhythmias. So these fatal arrhythmias are the common cause for sudden cardiac deaths in a lot of populations, especially the younger age group.
So we are always keeping a first aid kit at home, right, to prevent, to manage the injuries, right? So for heart attack, as in prevention, can we keep some medicines with us so we can give in case of emergencies before going to hospital or going to the doctor?
So that's a very important question, and I'm often asked that is there any single tablet or something which you can keep at home which can prevent heart attacks or sudden cardiac death? The answer is no.
Okay.
Why? See, most of the people say that you should keep Solvitrate at home or in your pocket because it can prevent heart attacks. It cannot prevent heart attacks. It is only an anti-anginal tablet which prevents chest pain, which relieves chest pain. But if there is an ongoing heart attack, it is not going to prevent it. Aspirin, yes, it is putatively a good agent or tablet to be kept if you suspect that the patient has heart attack. But then not all chest pain which you have is heart attack. Right, so we must understand that the differential diagnosis of a chest pain can be muscular pain, can be pleuritic pain because of the lung disease, it can be aortic dissection where the main artery of the heart ruptures or dissects. There can be, gastric ulcers or esophagitis. So there can be so many reasons for heart attack like symptoms.
Okay.
So giving aspirin for en masse use is again not something which is recommended by any of these scientific societies.
Okay.
In a nutshell, if you feel that there could be a heart attack or if you are at an alarm that we could be dealing with a heart attack, please go to the nearest hospital, get an ECG done, get an enzyme test like high sensitivity troponins done, and then your cardiac markers can be done. And, absolutely. And then your doctor can help you out for further management.
That's great. So we always listen, preventive is better than cure. So what preventive measures you would like to recommend to public to prevent from heart attack or sudden cardiac events?
That's very important because there are some very simple principles. So you should be active at least 150 minutes of moderate to high intensity exercises per week, which is about half an hour exercise for 5 days a week at least. You should be taking more fruits, vegetables and salads, which means more colors in your diet, more natural diet. So there is nothing wrong with egg or meat, but yes, you should probably avoid high fat meat or red meat, have more of fish and chicken, more roasted and boiled if you are a non-vegetarian. Otherwise, a diet which is low fat dairy, high fruits, vegetables and salads in content are always a good diet to have. Low sugar, low fat is always welcome. Sugar is the new enemy. It's actually much more dangerous and disruptive than fats and should be minimized. Your bakery products, colas, all these beverages which you get on the shelf, they are to be shunned. Avoid your children having a lot of say chips, cakes, etc. is not a very good thing. So I think these small little things, avoiding alcohol, we know that alcohol is injurious to health, not in terms of heart attack, but increases the risk of stroke and cancers. And smoking, an absolute no, not even a single puff, because it is linked to all heart attacks, strokes and cancers. So I think these are some of the broad principles which you should follow to prevent cardiovascular diseases.
So nowadays, as we are quoting for the modernization, so people, they are saying like quitting alcohol, quitting smoking is not possible. So it's part of our society and our friends and our culture. So how we can reduce that matlab, or we can eliminate from our life?
See, I don't think it is part of our culture. It is something which has been engineered or promoted to become part of the culture now, which is unfortunate, because the reason why we're getting so much of heart attacks, strokes in the young is because of the urbanization and the food habits and the lifestyles that we're having. And we have to understand that unless we know the basics, we follow the basics, you cannot prevent them. You have to have a much healthier lifestyles for you to live healthy and long. So I think it's personal choices. My job is to sensitize and to educate so that we can prevent heart attacks, strokes, so-called cardiovascular diseases for future, because they're the biggest killer than any other diseases put together.
Yeah, that's good. And my last question to you related to diet. So we are listening a lot about this oil is better than this oil. We cannot, and about the salt as well. Senda namak is better than this Tata salt namak. So and all that, right? What do you recommend for that? This olive oil is better than the mustard oil, right? So
that's a good question, very often asked question. So if you look at the monounsaturated and polyunsaturated fatty content, what we call as MUFA and PUFA, then both desi ghee has a good amount of MUFA and PUFA as well as saturated fats also. The mustard oil, which has traditionally been used in India the most, is a very balanced and good oil. There is nothing wrong with the mustard oil that we use. We don't need to use more expensive oils like the olive oil. There is no benefit. It is part of the Mediterranean diet, which is supposed to be good, rich in fruits, vegetables and salads, so it's used more as a dressing. It's not really a cooking oil medium for Indian style of cooking. Having said that, the best strategy is to rotate the oil. Some dishes can be in desi ghee, some in mustard oil, some in canola or rice bran or even olive oil. So these oils are considered reasonably good and almost equivalent to each other. But I think your traditional food habits, which have percolated down thousands of years, can't be wrong. And I think we should stick to the basic Indian style of cooking. Avoid samosas, kachoris, and very high fat fried content, which we know are bad. Avoid things which have trans fats, and anything which is deep fried, as you just said, is to be avoided. But it's not something that you can't have it ever. So be choosy about what you eat. And salt is definitely also linked to higher mortality, predominantly because of the hypertension and the kidney disease that it is linked with. And probably anything between 2 to 5 grams per day is all right, but must avoid excessive salt content in your diet. Lona or low sodium, high potassium content, sendha namak, etc. are okay if you don't have a kidney disease, if you don't have any additional problem or drugs if you're on drugs which can increase your potassium levels. Otherwise, you have to be careful using these salts and cannot be recommended for mass usage because of the high potassium content. But we know that high potassium in your diet helps in bringing down blood pressure. So that part is acceptable.
Yeah, and even I hear the people they are using reusing of the oil is very dangerous.
True.
Right?
Because it is supposed to generate more trans fats, which are the most lethal.
Yeah. So one and last question, because just after the conversations I realized that question may be important for the public. So what do you recommend for a preventive health checkup for the healthy person? Maybe they are feeling they are healthy at this point of time, but they are at risk, maybe at moderate risk.
That's important because in my last 25-30 years of practice, I have seen a lot of hospitals doing health checkups where they're doing TMT, etc. Now, in a 25 or a 30-year-old, treadmill will almost always be normal because they don't have so many of risk factors at that time. Yet, we keep on doing the treadmill test to rule out heart disease as a part of preventive strategy, which I don't agree to. The simple things like risk score. So we have very good risk scores like Q-Risk3 score, etc., where it's a questionnaire. You fill up that questionnaire, it takes 5 minutes. It will tell me your 10-year risk of heart attacks or strokes, where you stand today, and what is your 10-year risk. So it's a simple 5-minute, 10-minute job. Now, based on that, we can actually recommend. So you should do your lipid profile after the age of 20 years, every 5 years. You should at least check your blood sugar once. If you have a pre-diabetes, check it more often, maybe do an HbA1c. If you have a strong family history of heart disease and if you're over 40, then coronary CT calcium scores, etc. can be done. So there are many preventive strategies which your doctor can tell you. It should be part of your routine checks right from the age of 20 years onwards. Because the earlier you pick up these risk factors, the better prevention strategies can be applied.
So that routine checkup should be how frequent?
Well, it depends on your initial risk profile. So suppose I do my first checkup at 30 years of age and I find that I have hypertension, I have some pre-diabetes, then I can actually do that every 1 to 2 years. Suppose everything is fine and I'm young, I can do it every 3 to 5 years. So there are no strict rules about it. I think it's more of a common sense choice. But in India, because the screenings are very cheap and easily available, I think it can be done more frequently than what is recommended in the West.
Okay, that's great. Thank you so much, sir. So, guys, if you want to enroll yourself for a cardiac preventive care program and want to consult Dr. Vinayak, you can approach us, Seva at Home. Baki ka last